So do you see this with your medical kind of background as being a useful tool, as part of, a patient care system or something like that? Like, obviously you're one of the freshest waves of medical students coming through. Where do you find this process of reflection is powerful for, I remember being in the bed and saying, give me a score out of 10 for pain, or give me a score, these kind of things, you get those assessments. But, could you see that something like this could be useful in some of those cases?
Yeah, for sure. I mean, there's such a variety of things that you could use something like this for, these kind of reflection tools. I mean, not just for patients, obviously for doctors as well. It's hugely important. And self-reflection is sort of a necessary part of professional development as well. And like I was saying, very much like we were doing in swimming, and very, very much like when you're, trying to pursue I guess, a professional career in competitive sport. The same goes with any kind of high intensity profession, where you need to be reflecting on your own practice in order to be better. And that's sort of what the goal would be there. So certainly, as a doctor, something like this could be incredibly helpful. It can be incredibly good for teams working in an environment as well. So doctors in teams, putting together sort of team iyarns and checking in with each other as well, seeing how the group is performing. But then, exactly like you say, from a patient perspective as well, gives a great insight into how a patient is traveling. What sort of potential things that you could fill a wheel with can be anything from, like you say, from sort of pain scores and general well-being. You can also give them goals to achieve in terms of like rehabilitation goals too. So, older patients or patients coming out of surgery, you might want to put things like, rehabilitation and exercise might be key features. For people that have more lifestyle-based goals as well, if they have trouble with sort of, metabolic syndromes and things, there's certainly ways that those kind of things improve. Sleep, we know, is crucial for many, many things. It's highly interlinked with both physiological and psychological well-being, and that's one of the core facets of the wheel as well, that you can monitor on a anywhere from a daily to a weekly basis as well. And because of the sort of intuitive nature of the app and the wheel, it really does, exactly like you said before, give a real snapshot in terms of just quickly being able to assess how people are traveling in those sort of areas as well. So yeah, it's a very flexible tool, and certainly can be used in a variety of ways, anywhere from, like I say, doctor group well-being, patient well-being, for athletes, athlete well-being and future development, or even just personal development as well. So doesn't always have to be professional development. Like I've set up my sort of March wheel, just more of a personal reflection tool to go, well, what are some of the core things that I'd like to improve on, this month, this coming month, or these coming weeks, and how can I bring those numbers up?
Mate, I